right, welcome back to Fitness Fundamentals with Keenan and Jared. Super excited. This is episode 10 already. Very grateful to have Eric Duong, a good friend of mine, and super grateful to have him as a friend, but also outside of that, extremely well educated doctor of physical therapy, has his CSCS for multiple years. I've personally grown so much learning from Eric, and he's an incredible person and even better trainer and physical therapist.
Let's go.
Well,
First guess.
wow. After an introduction like that, I gotta live up to it. Well, appreciate you having me on, boys.
Well, Eric,
But yeah,
tell us about yourself, your intro, your background, maybe the hobbies that you have outside of physical therapy. Tell it all.
yeah. As a physical therapist, right now I'm more into the ortho sports scene. Everyone wants that's when they think about physical therapy, they usually lean towards that direction, or there's a split between like multiple avenues. But right now, I really want to try to get that mastery in that orthopedic and sports side of things, and like kind of running alongside this podcast and what you guys are all about here. I kind of started PT a little bit later in life, so I went through half of undergrad and didn't even know what physical therapy was. And
Wow.
once I found out about it, I kind of made the decision. It was like, this is kind of what calls to me, not so much as a job, but as part of like my identity as well. So that's kind of what split me through it. Growing up, I did a lot of sports, pretty much every sport under the sun. I think my parents were grateful. I'm grateful for my parents for signing me up for them. And then I think that just kind of blends into where my perspective is now. So yeah, we're about almost 2 years into being a licensed PT, and
Wow.
grateful to have met a lot of cool people like you guys along the way.
Yeah. And you said you're growing up playing sports. Was there like a maybe specific injury or specific sport that kind of brought you into the field, or what introduced you to PT?
So I'll answer that twofold. Not so much the specific injury growing up. I played a lot, so I'm dual citizen, Canadian American, Canadian, if you will, and so I grew up playing hockey and lacrosse mainly. And then I really thought about it. Like I was pretty lucky with injuries going all the way up until college, where I played a little bit there too. But then after that was over, that's a whole different aside. I transferred over to from the East Coast over to Northern Arizona University, and then I walked into a jiu-jitsu gym for the first time, and immediately got injured, as one does. And lucky enough, I was like, my rib's broken. But then one of the instructors or student instructors there, he was also a student of physical therapy in the doctoral program at Northern Arizona University. He's like, let me do something called palpation and a special test. I'm like, you just made those words up, but I'm like, okay, sure. So then he palpated and he actually scooped underneath the rib and then checked for crepitus manually, like basically using his fingertips as like his eyes basically. And he said, "No, you're good. Like you just have an oblique strain." And then I thought that was the coolest thing ever. And I asked him like what he was doing. And at the time, I was an English major. I mean, still am an English major, so I kept that degree while graduating. But I was like, what are you studying to be able to do that? He's like, I'm a or I'm in physical therapy school here. And then that's what we do like with our hands, with our eyes, and like, as non-invasive as possible. And there's a lot of ways you can go about it. He's actually a good friend of mine. Shout out to Dr. Anthony Velia. He actually just wrote a book. It's in my about dizziness. So he went a different route. He
Yeah.
went with the neuro side. But after that, I just had it in my head, and I was like, I need to do this somehow. And then I just looked at the prerequisites, and it was like a mountain that was here, and I was here. And I was like, all right, a lot of summers, I'm going to have to bring everything up to be ready for just apply to PT school.
Yeah. So when you started prerequisites, you had no understanding of anatomy, correct?
Zero. Like I looked at, if you give me a shin bone and you
Yeah.
gave me an arm bone, I mean, I would just flip a coin. So whenever I treat or whenever we train people as well, and I think that I've trained alongside Jared for a long time. Like I think he does a better job often than me of even like not dumbing it down. I try not to say like no one's dumb, but just like explain it as if like you're talking to yourself a couple years ago. Because once we get so deep into the clinical knowledge, and I even hear one of my alongside other PTs talking about like flexion, extension, and then like you could just easily replace those words with like forward and backwards. Like,
Mm,
so I think that bridge between, I might be getting ahead of myself here, but that bridge between that training and the PT clinical side, that how we talk to our patients and clients, I
mm.
think that's something I've been noticing for. But yeah, to answer your question, I had no idea what was going on. Just kind of went head first into it.
Yeah, even as a like undergrad studying kinesiology, a lot of these classes are like pretty overwhelming. I can't even imagine the levels that physical therapy students go 3 years in addition to their undergrad. So it's kind of
Hmm.
crazy for me to even picture that. But like what you said, as a kinesiology student, it helps me a lot by putting my school and academic work into actual practice. That's why I coach at BFT. And I feel like
Hmm.
that's the same way for you too. You kind of continually learn, even though you have that good baseline of your DPT, your CSCS. But what really makes you such a good PT and strength conditioning coach is the practice that you put into your work.
Yeah, and when Jared told me about, he's like, you gotta meet Keenan, you gotta meet Keenan. And like, I just know him from your background, like you're in the gym and applying it. It's kind of like I'm a big metaphor or analogy guy. Like my English degree is really old now, so sometimes I forget the difference between metaphor and analogy. But it's kind of like going to culinary school and then on top of that, working at the same time in a kitchen. That's how I think of as like fitness or kinesiology or PT. Is like, yeah, it's if I had to choose, I'd rather work in the kitchen as in like, I know, but you get the best of both worlds where you're in a good kinesiology program and you're working at a place that really like is hard on the compound movements and has like um a real strength and conditioning program too. So yeah, that's that marriage between like the real getting that real life and that school, I think is just something that's fundamental in every industry. And I think this sometimes gets lost a little bit, like starting to
Yeah,
a little bit in our field.
yeah, for sure. When you're in school and getting into the industry, were there any mentors, whether people that you've met or, you know, influencers, quote unquote influencers that you saw online that you aspired to be like when you're in PT school?
Hmm. Yeah. So I was lucky enough to do some of my shadowing in Flagstaff, and then Dr. Ryan Guy, he doesn't like to be called doctor, but I mean I'll just call it from that. Not really sure where he's at now, if he's still in the Flagstaff area, but he was my first time seeing like a good ortho clinician and like the clinical reasoning and how he explained to me with my very base knowledge of like anatomy one at the time to the
Wow.
patient who was like low like layman's terms, and then to his colleague at a clinical terms, just that shift of language between those three, like that's what I kind of had in my mind the whole time just watching him. Like I want to be like that, where I have mastery to not just sound smart but also be able to apply it to every single level so everyone's on the same page for the plan of care.
Yeah.
So that was my first, and then there's so many people along the way, but and then I had a chance to work in the other side of things at the rehab hospital in Northern Arizona, and a lot of neuro PTs along the way there who were really kind and giving me their time because I was just a technician, giving me their time, teaching things about. I got a head start about neurological conditions, spinal cord injuries, like the acute care type of thing, to how to heal the body or how to help try to heal the body from like not just our regular ACL tears and rotator cuff, but like the traumatic things like spinal cord injuries, burns, things like that. And she's kind of like gave me a bigger window into the scope of what the degree I was very unaware of that I was getting into. So kind of lucked out there.
Wow. Wow.
Mhm.
And then just going through school, I'm sure, like, especially with such a long time in school, you must have hit a breaking point where you maybe wanted to lose your shit or just give up. What was like a
Yeah,
pivotal moment for you, and how did you overcome that?
yeah. So man, that is such a such a real such a real feeling or such a real statement that I think universally, when you it's kind of like that the guy head nod where like you just kind of get it when you're walking across a guy like who really gets it, or girl. But
Yeah.
so I went to University of St. Augustine. It's in San Marcos, but for me, I was in a hybrid program. There's these kind of doctorate programs across the country. The most popular one probably is St. Augustine, where we do all of our didactic work. And I forget the difference. Didactic being the actual um, like the test and the reading online, the lectures online, and then we test our in hand or on hand or hands on rather stuff in person. So and that was every
Mm.
other week, and people make the sacrifice where some people live locally and they just need to work full time. In addition, that's kind of why the program exists. And then
Mm-hmm.
other people like myself, I was still in Flagstaff at the time, commuting over to California every 2 weeks or sometimes every weekend, and then trying to work between to maintain my apartment back in Arizona. But the the moment where there's two moments actually where I was like, okay, I got to I got to change fundamentally how I approach studying, how I approach like life. Was the first one where I had already taken the prereqs anatomy 1 and 2, and then gross anatomy cadaver lab. Um, we were getting introduced online during COVID, and then we got one chance to go to the cadaver lab and look at like someone who had donated their body to science, and we got assigned a piece of the body to prepare, and then we kind of rotate around the wheel. So I got the leg with one of my friends, well colleagues now. We've been friends for a long time, so we are chopping through the rec fem, and then just trying to like look at the IT band, and she
Oof,
like plucks it like a violin string.
oof.
He's like, "Wow, isn't
Ooh.
that so cool?" And she's from like the kinesiology program at Long Beach, so she had a very like dense background of that already. And then she's talking to me about these. Wow, look at this structure. Look at this structure. Look at this structure. And then afterwards, she gives me. I'm like, "Oh, well, I'm not really sure what that is. What that is. What that is." I'm like, "Can I see your study guide for the practical coming up?" And she sends it to me. And then this is the first, mind you, this is the first week of school, and I don't know any of the words on the sheet that she had already defined and like talked about the origin insertion of the muscle. It might as well have been a
Mhm.
different language to me. So that was
Wow.
like the
Yeah.
oh man, maybe like they shouldn't have let me in.
Oh,
uh,
dang.
yeah, so that was part one, and then part two was my first practical that I ever failed. So you have to get above an 80% on the hands-on portion of every single practical portion to uh, go forward, and you get a chance at a retake, which you have to then I think get like a 90%. Otherwise, you just get held back from a cohort. So
Mhm.
that's not just like the embarrassment, but also the time, the money, blah blah blah, and because you need to be with an entirely new cohort. So for applied anatomy, they were the first question was, where is the supraspinatus? So that's part of the rotator cuff. And I was just like, I knew it was like somewhere shoulder area. So then like on my partner who was trying to help me. So like our models are just our lab partners. So you can kind of get away with getting shifty of like, oh, like what's like resist flexion. Like and like sometimes you just kind of like resist a little bit more to give him like if you like him, give him a handout. So my buddy's trying
Yeah.
to like expose his shoulder to me like that. He's like this, like rolling up his sleeve, and I'm just like tricep. Like I don't know. And then and then it was like Jeopardy. He's like, is that your final answer? I'm just like, sure, I'll lock it in. And it's like, all right, well, see me after class. And then to
Oh,
drive home 7 hours to
Oh
Flagstaff,
no.
knowing that I had to like come back and do that again, or otherwise I would like be held back after just meeting anyone. That's where I'm just like,
um,
all right, I'm never gonna be caught lacking like that again. So, but it was all right. So that's the answer to the question where it's like it's not just a try harder, it's like try different kind of. And
Yeah.
I think it
mm,
survived a graduate program like that.
I mean, like you have all this like rigorous background, and not to talk down on personal trainers, but all we have to do is pass a CPT exam, which takes like maybe a month, not a lot. So there's a lot of good and a lot of bad personal trainers. But I would imagine that for PTs, especially doctor physical therapists, there's a certain threshold of knowledge and skill that you have to have in order to have that credential.
Mhm,
However, there are still considered, quote unquote, good and bad PTs. What do you think makes the difference between those that are good and provides good service with the patient in mind and
mhm.
the line between bad PTs who maybe don't either give results or maybe they're looking for something else other than providing a good service?
I love that question, and I'll answer it in my way, but I also want to do a brief segue on my little soapbox. If an insurance company were to answer that question, because that's kind of like what I wanted to lead into as well, or let's say a director of a rehab facility wanted to answer that question, a good PT would be someone who gets their notes and their billing done, and then like is efficient with their time. So that's what the kind of the profession wants us to be. But some of the best clinicians that I know, some of them who I've actually filled in for their shoes as they left, were borderline like fired by their places, but all the patients loved them and they got better. But their directors and the bosses hated them, not hated them, but like we're like, oh, that
Yeah.
guy, because their notes were left open or billing was jumbled up or whatever. So that's kind of the answer that the world wants to give us right now. But my answer is number one, like super easy. It's something like almost like unteachable in school, but teachable in life is someone who's just personable, like someone who just listens. Just take 10 seconds to like make eye contact with them while you're typing. Or if you're lucky enough to work in a sports setting, like a cash pay that I was lucky enough to for a little bit, just like put your hands down. It's like, so what's going on? And like genuinely listen for 10, 15 seconds. Cause if they've seen other healthcare professionals, or not to rag on like the people actually doing the stuff themselves, but it's like how often when you go to the doctor or anywhere else do they actually like ask you really how you're doing?
Right.
So being an empathetic person is number one, in any setting. And then two, especially in the ortho and sports setting, I would say just this is kind of like a not PC answer, but it's just true. It's like you gotta look like you actually like work out too, or
Mm.
like you actually can move your body. So if like I'm showing a bird dog and I just show my pictures and like I can't even stabilize my core, like who am I to tell someone who's like 65 to like, oh, you can do that too if
Mm.
I can't. Those two things beyond like a clinical way, I think will take you like not like 75% of the way. Like everything else is teachable through experience. So just living the life of like at least move your body around a little bit, or like and then just genuinely care and spend a good time listening as opposed to like try to tell the patient, or I guess like it's the same thing with coaching, show the client how smart you are,
Right.
how good you are. It's about them and their experience.
Yeah, and what would you say is like in a I mean in a insurance setting, is it just like you trying to get someone to do a specific move? Like are you trying to get them back to sport? How is it different in a PT insurance setting versus in a cash pay setting?
Yeah, so I've been fortunate enough to like kind of see the both worlds, but even within the insurance setting, there's like a whole nother subsection as well. So it depends on the type of insurance. For example, if it's like I'll leave names unnamed, but like a certain very, very uh large West Coast hospital organization that they have their own insurance. So it's basically their insurance is tied to the healthcare, tied to the clinician. So it's all one internal system. Um, Basically, in that kind of setting, it's all about getting getting the documentation done. Basically, it doesn't really matter how the patients are doing for the most part, because it's so backed up because they pay a membership program so the in network is only with that hospital, that you won't see them for 2 months. So like
Yeah.
they just have to, you have that 30 minutes to really like hammer in their home exercise program and like educate them and then finish the documentation. And as long as you do that on time, then that's kind of what they care about. In terms of like a private pay, so for example, you go to your primary care physician, you have like a regular type of insurance, and then they send you to a named clinic that has like says sports clinic or whatever, but they see multiple kinds of insurances. You'll probably be sharing your time other than evaluation as a patient with like another what's called double booking. So like two people at a time
Yeah.
maybe looks at you for like 10 seconds. And that's kind of the same deal where you might get some more manual work. So for me, I would give some more hands-on. But they're still at the same time looking for the insurance because it doesn't really matter. So I guess the same answer for the insurance. It's just not great overall.
Yeah.
For cash pay, it's about the results, but it's also tied into the sales. So I had an issue, and this isn't like to hype me up myself up or anything, where when I was in cash pay, I'd see them for the initial consultation, which would be like a pretty penny for them. And then I would be like, hey, you're actually good. Like, I think you should be okay for now. But that means that they don't come back and they don't pay for more sessions. So it's kind of like the sales side of things too for the cash pay. It's like how do we balance um like an appropriate amount of care with actually like maintaining, like making sure the clinic stays open, as opposed to on the
Mm-hmm.
insurance side, you have more time, but it's kind of on you if like for to meet these goals and such for the insurance companies, because like if they actually get better or not, like the insurances don't really care, like but you have to care, but you also have less resources because you're juggling three people as opposed to 1 hour with one person. So
Yeah.
that's where we're at. Maybe we're trying. Like I don't. I wish I knew the answer. I've talked to a lot of people higher up and more experienced than me who would like a, they think they have the answer. Like we're trying something new, but so far I can't really think of like a way to solve the issue other than to get our suits on in lobby in Washington. But I think that's why it's so important, because I feel like personal training in a lot of way is somewhat more accessible, or group fitness, especially group fitness, is so much more accessible. So if like trainers are armed with that knowledge of how to do like rehabilitation, because it's like kind of all, this, you might have better tools in a clinic. Like for example, most places I've worked at for PT don't have heavy bands, which are essential for like long axis distractions or like posterior glides. I see you guys doing that at BFT a lot. Um, yeah, so I think in a lot of ways, because it's so inundated right now and or outdated, I think personal training has a really, and group fitness has a really good opportunity to help kind of like aid in that.
Yeah.
Mm.
I was volunteering at a PT clinic a couple summers ago, and what you were saying, right, is one PT scheduling two or three patients within the same hour, and they would
Yeah.
see them for 15 minutes, maybe for some manual therapy, only they can do. After that, they'll hand them off to a PT aide. Like,
Mhm.
my question to you is, are PT aides like actually necessary? Like, in a general hospital, yeah, nurses to doctors go hand in hand, but like does it really have to be a PT aide or can it just be the PT and the patient?
That's a really good question. PT, I've actually very recently have experiences with both throughout my travels, because I'm a travel PT, so I kind of bounce from place to place. But one of them tried to do the PT aid-less situation while still using insurance. So what they would do is they would double book you, but you're kind of monitoring the patient doing exercise over there while you're doing manual on
Mm.
one,
Oh,
and then they come at the same time. You're trying to like manage two at the same time. So it's like you're doing basically a 1v2, but without the aid. So like it's really at your discretion. So it's all you. And then another place was quadruple basically. So the aid would like, run three people too, and then you'd be bouncing around doing manual if necessary on all of them. And so I guess to answer your question, it really depends on. I think that aids for a certain model of care. I think for certain, what's it called, cases where it could be healed through mostly exercise, allows the clinic to actually stay above water, because reimbursement rates are like kind of terrible. But if you're doing one-on-one care, or yeah, one-on-one care, I think that in an ideal world it would just be one-on-one PT and and um and patient. But as a former aide myself, because that's kind of like you know, the way you get the hours to experience
right,
it. I think aides right now are necessary. Like they always will be. Not even right now.
right,
They always will be necessary. But the over reliance on them is unfair to the aide and also unfair to the patient, in order for the clinic to not close down.
right. Because I know some physical therapists. I think Dr. Albert is too. Jared and I know him. Like they
Mm-hmm.
run their business independently. So they kind of act as personal trainers, right? You charge
Mm-hmm.
more than what a personal trainer will typically charge because of your background and experience. But you basically get to spend the entire 50 minutes to an hour with the patient doing strength training in addition to just manual therapy. So I don't know. I feel like that's for me like an ideal way to treat an injured patient.
It is.
Um, but yeah, it is more difficult because you're number one, you're not relying on insurance companies to feed you people or clients, and you have to kind of create your own business yourself, which is much
Mm-hmm.
more difficult, right? You can't be with Kaiser or another company to help you do that.
Mm-hmm. Yeah, and I followed Dr. Albert for a while too, and like part of it is like you have to understand how to run a business at a fundamental level, regardless. And I feel like most PTs, like we just don't, like this is not something we think about. We're really good employees, but not many of us. It kind of is changing with like the generations I'm with are not very business owner oriented, and we're not trained to be that way. Actually, it's kind of like almost discouraged, because the way that we go through business class, like we have like a business module in PT school, but it's really more so geared towards, and I can't speak for like many other programs, but it's really geared more towards like how do you like not strike out on your own, but how do you be a good employee essentially. So
Yeah.
it's kind of the way it is. I don't think it's malicious, but it's just easier that way. But you're right that way where you get the one-on-one time, that full hour, if you're compensated fairly, would be amazing. That would be amazing if insurance could one day, you know, accommodate that.
One day, Eric, you're gonna change
Yeah.
the world. One day.
Yeah. I'll lobby up there, and then they'll smear me somehow. I don't know.
Yeah. What else would you change about PT education having gone through it?
Oh man, so much. But from a clinical perspective, you'd be shocked to see that or see that like how little or no time at all we spend on exercise prescription, which is like
Wow.
90% of like what we do
Yeah.
clinically. It's like, how do you
Mm.
coach a proper push up? That's not that. How do you coach a squat vaguely? Like it depends on what school you go to, but not at the level of like even like when you go into like a personal training or strength conditioning coach internship, you'll get way more out of that than all PT school, or like how to use a TRX, or like, what it's just not that. And, I love the TRX, but like me personally, it's like, all right, guys, we're gonna start TRX, so I figure out what to do. But um yeah, exercise prescription uh is really just lacking at all, because they're so worried about the national licensing exam.
Mm.
When I first met Jared, I was still going through all of that. That
Yeah.
like, and they're not asking you how to like, how yourself to do a squat or how to coach a lateral lunge. It's not really those kind of questions. So exercise prescription one, two, accessibility. And I think that's all healthcare as well. I mean, for med school and all of those things, it's like if you look at who gets into like the top med schools, it's usually like higher end income already. Like you kind of have like that background from your parents, that safety net. So that when you go work with, and I've worked with a lot of people, a lot of clients and patients who are from a lower income, it's like I sometimes think about like, well, like if we come from different like backgrounds, there's not that many people who get that elevation from like the PT school or like scholarships because it's a graduate program. So like socioeconomically, it's kind of like from like the middle upper class like and above, and then so it kind of just stays in that type of person that goes through. So that's a second thing I would definitely change. And then third, I might get canceled for this, so get ready. There's a organization called the APTA. I'm really not sure what they do, to be honest.
Yeah.
They have like a conference every year, and they kind of like own everything. Like, guys, lobby for us. Like, do something. It's
Mm.
cool that we have a conference every year, but like the profession is getting slammed. People are quitting. So like, if you guys represent all of us and you make us pay a membership while we're in school, like get on
Mm.
it, do
Yeah.
something. And I'll probably get canceled for that, but whatever. It is what it is. So I just gotta say it.
Do you think the
So those
injury in do you think the industry is getting oversaturated?
Hmm. Yes and no. I think so. St. Augustine is notorious for kind of just like, well, they got bought out by more private equity, I think. So like they're shortening the program and increasing the amount of cohorts that are run through the year. So there are more graduates than ever. You still have to pass the licensing exam, but I don't think there's so much of like it feels like there's a saturation because there's more and more, but the need I think is outpacing.
Mm,
The need is out. I've never had an issue if like a job doesn't work out, finding a job within like the same day as a PT.
Mm.
I don't think that
wow.
really, and like I'm pretty selective about what I want to look at. So even within that niche, like I think there's still a greater need than people going into it. I think a lot of people like it feels like it because they want to go to physical therapy school for one reason or another. Like they don't actually make it all the way through. So the burnout rate is actually, I don't know the exact percentage, but it's pretty high. I think a lot of, if you look at all the people who say like I'm pre PT to who actually makes it to the end zone, it's pretty
Mm.
low. I
Mm,
don't know how it compares to med school and nursing, but I would assume it's kind of the same.
yeah. You were mentioning earlier how, it's important for physical therapists to kind of practice what they preach, do strength training, know how to do the exercises, and be, relatively fit to do those exercises, which is why for me, when I see a PT, I'm thinking, okay, a PT, but with a PT and a CSCS, I'm like, okay, this guy really knows something, right?
Try to
So
be, yeah.
what's the importance of, strength training, or even the stuff that we, Coach Jared and I, do on, personal training? What's the importance of that type of work blended in with, rehab and booty band work that,
Yeah.
a lot of PTs do?
Clamshells while I finish up my documentation. Essentially, I'm gonna go on a limb here, not just because you guys were kind enough to invite me on the podcast, but I straight up, truly, I think the stuff you do for a strength, like a actual programmed and a properly programmed strength conditioning program, is a lot more effective for preventing injury and like overall, like especially since you guys are coaching them through form all the time too, and like them as clients, is much better as preventative care than, let's say, they injure themselves and go see me where I have a limited tool set, limited time, like, and like just like these little booty bands. Because what is most important, I think, that is being really neglected right now is, especially, and that's a kind of circling back on my previous point as well, is that we're not taught not just exercises, but the stimulus of the exercise too, for like a healthy person, because it's about safety or whatever. Like, don't have to load, don't load too much on them. Like, a lot of these people we will be working with are frailer, but for, your clientele, and when I'm in sports, my clientele as well, um, we need a proper stimulus for the tissue to adapt. And you're just not going to see that in most like cookie cutter PT mill places. So to answer your question, I think it's everything. I think that's to be able to have a knowledge of progressive overload, how to program an athlete through a season, or knowing the difference between a type of, even a hobby. When I say athlete, I mean like if you do something for fun, like let's say you run a half marathon or a 5K, like that's still, I would program, like that's still a type of programming where you're programmed for an event. So you want to peak before the event versus a season. And because they have that accessibility to that personalized programming, they're much less likely to get injured than, someone who doesn't have that, basically. And it's just something, as a PT, I feel like we get too bogged down and just getting the notes done. So like I think it's having that strength background and like knowing how to actually like lift weights and the importance of lifting weights. Um, I hope it sets me apart in my career where like I feel like good about what I do, and I don't feel like, I feel like a lot of PTs, they start to see the results or the lack of results. Like, oh, this person's back for lower back pain again. And you see them again and again and again, and you start to look at yourself like, I wasn't taught how to deal with this. What am I doing wrong? Is it me, or is it like the amount of care and the stuff I'm allowed to prescribe, and my knowledge or my lack of knowledge of strength? So that's why I wanted to look outside of just PT school to like, understand the barbell and understand dumbbells, understand, you know the buzzword functional movement.
Yeah.
Everyone's favorite word. Yeah.
So in clinics, do they have heavy weights? Do they have like cable machines or barbells and heavy dumbbells?
That's funny you asked that, because it's like a toss up depending on the owner, what they feel like their budget is, what the space is. And even within the same company that has like a chain, one clinic might have something as cool as a reverse hyper. And you
Mm,
guys are familiar with that, like one of the
yeah.
best tools for healing back injuries that I know of. And then at the clinic next, like the same company, same name, they might just have like 2 3 pound dumbbells and like a couple bands. So it's under the same name. So it's like, if you live here, man, you're gonna get the reverse hyper, all that good stuff, and like a turf and like a sled. And as you live
Yeah.
like 30 minutes and you get referred by the same physician, you might just be doing, like not that there's anything wrong with like banded squats, but like for 5 feet, because the clinic's so
Yeah.
small. So it really is, yeah, it's really a toss up. And you might get lucky, you might not. But I know that in a lot of sports clinics, that's what they set them apart, or they plant them within a gym and like share the space with the gym so they have that access. And I think that's something, every time I interview somewhere, like that's not just for like a travel contract, I kind of ask like, what does the space look like? What can I do? Like,
Mm.
so yeah, again, leading back to the proper stimulation of the muscle.
Yeah. So we talked a lot about, basically, let's just say there's two camps. There's PTs and S&C, or strength conditioning coaches. We talked
Mhm.
about how S&C provided, strength training, progressive overload, to the PT industry, what's the most important thing that the PT industry has provided for us S&C coaches?
Ooh, I think that's kind of twofold, or I'll just go with the clinical sense is that just an understanding of things like osteokinematics and or arthrokinematics, basically how the joints move around the muscle and like basically the relationship between muscle and joints and like what is if something is limited, how to address that and like how to basically look at a person with a, for example, overhead and that like one is going for more than the other, like just kind of giving an idea of like, okay, what should we look at? Are we looking at the shoulder blade? Are we looking at this like the rotator cuff? What is the issue? And like kind of just giving us another tool set where we can help S&C coaches kind of dial in where an athlete might be lacking, and then kind of almost like giving them like like light PT, like PT light,
Yeah.
before things get horrendous. And also at the same time, I just maybe this might be even before my generation. I think a lot of strength coaches are way above this now. I hope so. Is like understanding like rest versus work ratios as well. Um, I think that physical like physical therapists and S&C has kind of grown together in that. So yeah, I think those are the a couple of things. The knowledge of movement anatomy, and what could be looked at in an athlete, um, and then and then on top of that, like the importance of rest as well.
Yeah, that's something I definitely learned a ton from you was like what joints are stabilizing, what's maybe a muscle that isn't firing properly. Like a great example was I think someone was having shoulder issue and Eric came into the gym and started doing serratus stuff. My
Yeah.
mind blew. My mind blew when I first did that. I was like, I never felt that before.
Yeah. The old acronym that got me through the board was either lust or slut, depending on how fun you're feeling. With the upward rotators of the scapula is lower trap, upper trap, and serratus. And depending on what order you want to put them in, those are the two acronyms. And then, yeah, that's it. Really all boils down to like a couple of like what I think about is certain structures mirror each other in the body. Like shoulder
Mm,
is kind of the same as
mhm.
like a hip in a certain sense. So
Yeah.
once you kind of start to match things together in your head, then I think I think there's a lot of trainers I think who even have like a deeper knowledge than me about that, where it's like they understand the relationship where like not just up and not at the joint, but up the joint as well. And I think that's something that's PT has made more accessible to training. Like we're not trying to, I'm not trying to gatekeep it, you know, like I want everyone, I want people to know. And
Yeah.
I don't know any PTs who do that, but if there are, I was like, I don't think that we're those type of people. So I think that's what PT is given
Mhm,
to personal training and strength.
mhm.
Yeah. When personal trainers were training clients, when is the point where you think it's smart to refer the client to a PT? Of course, injuries, obviously, but is there any other circumstance where, you know, S&C coaches, personal trainers, or even people working out themselves, they have an issue
Mhm.
that they're trying to fix, whether that's like shoulder impingement? What's the line that you draw to where if they cross it, you should probably go see a PT?
Yeah. So as a personal trainer and strength conditioning coach, I think that if you're licensed and have like the certification, you should be able to progress and regress the exercises. So you should have like an idea of what you want to do. And then like, oh, it's too easy, progress. If it's a kind of hurting, either substitute it or regress it. And if your client is, you know, still dealing with that issue or they come back, oh, it's worse the next day, I think that's a good time to
Mm.
refer. So like you have your own, you know, I'm not saying like, oh, the second anything hurts, refer it. But if you within your scope, you regress the exercises or give an alternative and just still like, this is like still not it, then I think that's always a good time to recommend that referral.
Got you. So talked about going that way. How about going the other way? When should, you know, or
Mm,
do even PTs kind of feel like, okay, my care is enough. I'm gonna hand you off to a personal trainer, and then he
Mhm.
will do the job of strength training, progressive overload, all that good stuff.
Yeah. So what we look for, we set these things called SMART goals, which is like they're not they might or may not be smart. It's just an acronym again,
Yeah.
but it's basically like you set goals, short term and long term goals for your plan of care. And once you reach those long term goals, they might not necessarily be like 100% pain free, it could be like 85% pain free. Once you reach those goals, then I think it's a good bridge, a good time for the PT to have a conversation like, hey, uh, if you have the time or you should make the time, I would recommend you continue your strengthening. Like, but I don't think you need like my specialized care anymore because I don't think you're at risk of re-injury at this point with like what you've been doing. So once your long-term goals are met, I think that's a good time to refer out to like back to like a lifestyle type thing. I will go out even more on a limb. I think that if you have a good relationship, and some PT clinics try to do this with personal trainers that you trust, or even within house, basically, then you can work with them through the short-term goals as well. So as long as everyone's on the same page, which is very rare that there's facilities that do that, but there are some, but I think that the personal trainer or strength coach should be involved all the way through in some extent.
Yeah, I agree with you. I think there needs to be like a better blend between physical therapists and personal trainers because I feel like there's no blend. Like, it's very, you got to kind of try to make that connection yourself. There's not
Mm-hmm.
really a mutual agreement between like, let's just say a gym and a PT clinic, like between Equinox and I don't know, like a PT clinic, right? I feel like
Mm-hmm.
there's going to be a lot better because sometimes, or most of the times, the people or the clients going to physical therapy are the ones that need personal training the most. And trying to
Yeah.
find that care is going to be pretty difficult. There's no mutual agreement between the two.
Yeah, and that's funny you mentioned Equinox because I even worked in a PT clinic that like shared space in Equinox. I didn't know any of the person like they weren't introduced to me at all. There's no like segue between
Oh,
it. Like they'd be like, "Should I go back to my personal trainer?" Like I don't know who that is, even though we're in the same building. So
wow.
yeah, I think that's something that could. I'm not sure how to facilitate that, but if I were to ever run something, I would make sure that there's that line of communication because we're basically like in the same line of care.
And then also in the clinical setting, has there ever been anything or having a clinical background has it ever changed your mindset as you program for someone who's just like a personal training client?
Yeah, definitely. Especially with at our job at Fitness Together, like we have a lot of older clients who maybe have not been active or dealing with certain things. Um,
Mm-hmm.
yes, especially like the clinical side of things makes me more aware of things like, for example, like neurological disorders, or for example, we had like a patient with like cerebral palsy, like just bringing that side of things into it. What exercises or my what hands-on care I could provide in a personal training setting that would fit with their strength goals, or something like neuralgia or like sciatica. Like that's a big one too. We always have those patients like, I have lower back pain, and guess what? It runs down the back of my leg. Like it's just like that's something I hear in my dreams every night. So just having that knowledge of like the nervous system as well. I think from like the neuro side of PT, I think adds a lot into what I decide to program, what I think that would be beneficial versus what I would probably pull out a little bit from like a personal training type of client.
Going a little bit off topic, but I know we can probably go hours and hours on this topic, but like when a person is injured or feels pain, where do you decide to go? General practitioner, physical therapist, chiropractor. There's so many routes, right? How do they
Mhm.
know where to go?
Oh yeah, like that's how certain professions make their money, right? It's like, oh, they don't know where to go. Come to me, like stay with me for 10 years. It's like, oh, I love them. Like I've seen them for 10 years. Like, why aren't you better? But anyways, but in an ideal world from a physical therapy perspective, certain states are called direct access states. So you don't have to see a general physician to go see a PT. If you get a chance to do that and it doesn't cost you an arm and a leg, I would do that. As far as like the most routes you go is you go through your primary care, and then what I see as a PT is they give you like the most general diagnosis ever, and that's not on them. It's just kind of like what they have to do, like they like low back pain or radiculopathy if you have shooting pain down your arm, and then they send you back to me anyways. So I would my answer would be like if you can do direct access, I would try to do that, but most people's insurances don't allow that for it to happen. So you're gonna have to go through the primary care, and that's just and then that takes time as well, so
Yeah.
while you're still in pain. So that's I
So
wish
how
I had a
about
better answer.
yeah?
Sorry, go
How about
ahead.
like chiropractor versus physical therapy?
There's a good chiropractors out there. I've heard if I would get my soapbox, I wouldn't let any like the thing with chiropractic care is that a lot of it is outside of insurance, like won't cover it. And I've met good chiropractors out there. I've also treated a lot of patients who got preemptively maniped, like the grade 5 thrust, on things that were probably, they didn't need to or was contraindicated, like they're an older patient. Like research indicates that at a certain age, like the the manip will probably hurt you more than help you. Um, so I I with Kairos, like it's just again a mixed bag. There's some Kairos who are like very like I've seen their stuff and it's very akin to like really just good cash pay PT. And there's other ones who are doing like spirit healing, And I think the good Kairos will
It's very
do the same thing, will say the same thing. Like someone like Dr. Albert, I'm like, man, that guy, I've never met him, but like that guy knows his stuff. I could definitely learn a lot from him. And then on the other end of the spectrum, I like attest like the very best. And I'm like, dude, if you have the cash, please see him. But on the other end of the spectrum, there's people doing like, the thing like they pull like the imaginary energy
I've
off the
seen
stomach. It's
that.
like go away in the sagittal plane. So I think yeah. So I think I'm not sure. I could be wrong about this, but I'm pretty sure we have in PT we have like a governing board basically that like kind of is like the PT police. And if they see someone doing something weird, they'll like hop on you and be like, "We're gonna take your licenses away." But I'm not sure if chiropractic care has that. So that's kind of
Mm.
my 2 cents for anyone listening. Like I'm not gonna rag on all, but like there's sometimes there should be the hall monitors there to watch out for the profession. Otherwise, things get a little bit weird.
Right, right. That makes sense. And I mean, there's so many different things now between like stretch, acupuncture. There's
Yeah.
now new facilities doing like sauna, compression, red light
Yeah.
therapy. What is kind of like your favorite tool or modality that you use in your practice? Whether it's what's that gel one called? The shockwave
Shockwave.
therapy? Yeah,
Uh,
like what are kind of some of your favorite modalities that help with injuries?
Okay. So before I preface that with like active is always better than passive. Like you doing it, like putting your muscle through the stimulation yourself is always
Mm.
better. But if
Mm,
you're gonna go to passive, in addition, to your active rehab plan where you have to do the hard work yourself, I would say that if you have a really good massage therapist, like it's pretty like honestly, sometimes it's even better than like crappy manual therapy because manual is not just soft tissue, but like I work on the joints as well. And like
mm,
some PTs are better than others at it. So I've met some massage therapists who are like have a pretty deep clinical knowledge of fascia and the human body and all that stuff. And I feel like with those kind of things, which is hands on, what you want from passive is to not make things worse. So hands is like lowest risk. I know there's
mhm,
research coming out with shockwave therapy.
mhm.
Um, but I tried it myself. I know there's different kinds of shockwave treatments, but so I'm just gonna charge my laptop real quick. There's a lot of different kinds of shockwave machines themselves. So I would look into like what like how recent it is. Ultrasounds just don't do it. Like that's just a waste of time. That's like like I don't know why they even have them there anymore. So, and then as far as like red light and sauna and all that stuff, I think it's just like that's just be part of your lifestyle. Yeah, that's kind of like my descending order of things.
Okay.
Like I go for the research first, but like
Mhm.
if something like ice bath or heat like makes you feel better, I think that also actually has a really good benefit because there's studies that show that um, basically one of the biggest predictors of injury is just stress. And if like taking care of yourself
Mm,
brings down your stress, then amazing. That's better than if you got like a bunch of expensive shockwave done on you.
that makes sense.
Hmm. So yeah, I think everyone should have access to that kind of stuff, but it's not. I don't think it's like the be all end all.
Mm.
Segueing our conversation into injuries, what is the most common injury that you see in practice?
Lower back pain, insidious onset, with shooting with or without radicular symptoms down the back of the leg. I would
Mm.
say, and when they say like core stability. I think just the ability to there's muscles called the muscle called the multifidus. I call it car crash muscle, which basically is like think of like a kebab, right? Like the stick is your spine, and then the meat around it is your multifidus. Basically holds it in place and contracts whenever you get hit or like when you're moving around. So weakness in that deep core muscle over the years and years and years will lead to things within the structure of the spine like just kind of deteriorating. So that is definitely the most common. And I think we're kind of, or at least you guys are young guns. I'm reaching the age where it's like the most common injury for someone active my age is a disc herniation as well.
Mm.
So from a lifting injury from pulling up off of the ground. So yeah, low back pain is for sure like I think a multi-billion-dollar industry, unfortunately, in America. I'm like,
Why do
where
you,
is it? Where like I don't get a cut of it, but whatever.
yeah. Why do you suppose so? Like, do you think it's just genetics? Do you think it's poor movement patterns, poor coaching from a coach? What do you think causes, or main cause, or just multiple causes? But what do you think is the main one of lower back pain?
I would say a lack of a coach. There's
Mm.
inactivity. All these people, when you ask them to, I know our favorite catchphrase from one of my previous job I worked with Jared was posterior pelvic tilt. Have you heard belly button to spine? But like we joke about it, but like most people can't do that or have never even heard of doing something like that. So just a lack of intentional movement or intentional bracing of the core over years and years. And then a lot of sitting as well. Like we're all sitting right now. Think of how our hips are tilted forward, our spine's a little bit compressed forward. So we're actually kind of most of the time right now in a little bit of flexion. And if we're, really like weird about it, the lower back is actually in lordosis, which is bending backwards. So just spending a lot of time in any fixed position, whether it's forward or backwards, is going to cause that low back pain because the structures aren't there to support kind of like the towers here and it's a little bit bent, the force has to go somewhere. And we don't notice it, don't notice it, don't notice it. And then all of a sudden we notice it and we're not prepared to move our body to, try to correct it.
Yeah, I always try to recommend clients and members who work at desk jobs and sit, 8 hours a day to just stand up every 30 minutes to an hour, like set a timer on your phone. Are there any other good practices to, especially office people who sit a lot?
I would say think about like flexion versus extension, right? So flexion being forward, extension being backward. Think about how much time like you spend in either one. Very rarely do all of us spend time like leaning back like that all day. So most people are gonna be flexion biased. So when you are getting up and moving around, think about the spine specifically. Like, should I try to get some back bends in there or forward bends? Most of the time, the answer is going to be back bends. So intentionally moving the spine itself, and then again segueing to lack of coaching versus bad coaching. Honestly, I think just any coaching or any kind of like planned workout where you're going through like a programmed workout, like I feel like the people at BFT are like in the 1% of just even trying to like do a class workout in
Mhm.
America at least. And then like we're in the fittest city or fittest city too in San Diego. So yeah, I think that setting aside time to do strength training is probably like the biggest, even if like you're kind of like half-assing it is kind of the biggest best way to prevent lower back pain.
Yeah. And from your perspective, for a healthy individual that works out, maybe occasionally gets some low back pain here and there, but nothing significant. Whatever, maybe
Mhm.
your top three exercises that you would want to program for them.
Ooh, yeah, that's a really good one. Before I even program, I would look above and below the joint, maybe even two below the joint. So like that means like if it's lower back pain, look at the hip and the knee, how it's moving, perhaps even the foot as well. And then look at their rotation on the other end of the spectrum with the thoracic rotation. So I look at the limitations above and below, and then that's usually what's causing, the
Mm.
symptom there. But in general, like some of the most effective ones I've seen so far is a side plank, like literally just a side plank where you're on the side and I'm strengthening the glute med as well. And then there's variations of that. If you look up DNS, which is like dynamic neural stability, which basically just is like someone patented a bunch of ways to do planks basically. It's like you do the plank and then you raise the leg, or you use the plank and then you reach through, or you use the plank and go into like a pattern where you're kicking back and reaching, like that kind of stress basically. while activating your glute med. Glute med is muscle on the side here that kind of stabilizes you side to side. Side plank would be the number one. Two, I would probably do a sort of glute bridge. Um,
Mm-hmm.
but by glute bridge, I mean activating the glute as opposed to hamstring. A good way to test for that is like, hey, do like no coaching, do a glute bridge, and then like, what do you feel? Lower back, hamstring, butt. And if they have lower back pain, there's a good chance like I don't feel my butt at all. So you do what you do is you could bias, or what I would do. I'm not saying what everyone should do, but what I would do is try to bias the glute max in any way I can, so they can feel their butt. Because without the butt, if you look at old people, a lot of times like they just lose their butt and then ow, man, my back hurts. The butt's super important to, basically hold the spine in place. So
Yeah.
bias it by putting your digging your heels into the mat as opposed to bridging off of your feet. That's one way to do it, or change the angle, or even provide resistance like with a band or something like that to get
Mm.
them to feel their butt, and then get them upright again and see if that makes a difference after. Third one, let's see, I would probably go some sort of bird dog variation, to be honest. I think
Mm.
the little coordination there, where it's like, okay, right, left, right, um, and it strengthens not just your lower back, but also your transverse abdominis, like your abs as well. Getting them to fire at the same time creates that 360 as well. There's something called the McGill Big Three, actually, where I just kind of
Yeah.
mentioned all three of those, or I mentioned two of the three.
Yeah.
The third
Yeah.
one is just like this weird neutral sit up type situation.
Yeah.
So that's like, I guess, the easiest way to go about the three exercises. But sometimes I change it up, I spice up just a little bit based on the person.
Nice.
We talked a
Mhm.
little bit about rotation earlier.
Mhm.
Even people who regularly go to the gym or people sometimes who even have personal trainers is not often that you program or see rotation. How important is rotation for preventing injury?
Oh, dude, it's like it's so neglected. Particularly if you look at the hip rotation and then like thoracic rotation. So kind of like that centerpiece on the like on your back and then right at your hips. And if you're able to rotate the thoracic spine and the hip, it just takes so much pressure off your lower back, kind of harping back on that low back injury.
Mm.
There's a lot of schools of thought on how to do it. There's like this one kind of like uh program thing called applied functional science, where like it's relative, where like you plant one leg and then you just rotate around it to create rotation, or you drop in 3D patterns. There's PNF, which is another, I don't know who makes up all these acronyms, but essentially it's just like going diagonal in rotation. There's so many ways to go about it, but I think as long as you're loading the rotation, something I really like to do is an isometric squeeze with the rotation, where you grab like a ball. I don't have any acronym for it. It's just you just squeeze a ball and then you rotate. Then it's basically teaching the body how to contract, like how to protect yourself while you go into rotation. So you're not like loosey goosey in the wind as you try to rotate, and then something gets like dislodged or like pulled out of place. So I think any good program should incorporate some sort of rotation at the hip and the thoracic spine, those two areas in particular.
Yeah, I mean, I can already tell that people lack that because as a personal trainer, you would think that maybe a hip hinge is the hardest thing to coach. But in my
Yeah.
experience, dude, rotation is like the hardest to coach because
Yeah.
people
Yeah.
are limited. Either they physically can't do it, or neurologically, they can't connect to their muscles of like, how do I
Right.
rotate my torso, right? Because no one does it.
They start moving like tanks, right? Like the whole
Right.
thing starts to like, we're like, no, 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 like you have to hold them in place, and then they start fighting you to try to like walk their feet.
Yeah, and
Yeah,
it's
there's
so important just because even when you walk, it requires some rotation just as you walk. So if someone's
hmm
very stiff and a lot of older people, they walk very stiff.
hmm
Really important to get that rotation, allow the shoulders to move too.
especially at the trunk, where right moving up from that lumbar spine to the thoracic spine, you can look at their arm swing, like, oh, swing your arms more. A lot of times it's like it's not their arm swing, it's like the lack of rotation means their arms won't swing naturally because they're just
Mm,
like this all the time. Granted,
wow.
I mean, I probably sometimes do that too. So yeah, more rotation for all of us.
Yeah, even like walking with their phones in their hands,
Yeah, yeah,
no
yeah,
arms. Yeah,
exactly.
exactly.
Yeah.
We talked a lot about physical side of physical therapy. Let's talk about the psychology of it. How
hmm
important is the psychology of the patient when treating an injury?
I think it's like honestly at least half the battle, if not more, a lot of the time. It's because if like their psychosomatic pain is something I see it quite a bit too. Not like not directly, but secondary. If you have an aversion to something, like I kind of see it on like when they circle the chart in the waiting room or whatever, where it's like out of 10, how do you feel about this? And like they're, it occupies them all the time. Like that aversion to it, is gonna probably cause their pain to last a lot longer than if there wasn't there. So there's no real, it's like a soft skill. There's no real uh tech technique in terms of from a PT perspective. I know psychologically there is, but like we don't document anything of like how to
Mm.
basically talk to the patient to help them not just understand it, but realize that if it can get better, how it can get better, and if the pain isn't going to improve drastically, how to live with it as well. So I think the mental part of it and learning how to talk to people like as personal trainers or patients is like not having that fear mindset, like, oh God, there's pain. Like, okay, there's pain. What is it telling us? And I'm sure you guys already do that too. But sometimes when I'm dealing with so much pain all day, like you trying to forget that little mindset change of like there's pain, that's probably a given. How do we deal with it as opposed to like let's try to run away from the pain. And if we can't get the pain to like subside to zero, oh no, it's not like oh no, we're at a loss. It's like okay, how do we still function with that pain?
What advice would you give to a younger PT that maybe hasn't ran into someone who has a 9 out of 10, 10 out of 10 pain, very emotional with their pain, and they come to you looking at you as like a savior, or someone that is going to get them out of this traumatic thing? What advice
Mhm.
would you give to a younger PT to help them speak to someone in that kind of pain?
Yeah, in a from even from a PT or personal trainer, it's just like you don't have to answer right away. Like, they came in, they walked in to see you, unless you're like at a hospital, like they walked in to see you, like you can take 10 seconds to think about it and answer the question, as opposed to like, oh, let's do this right away. That would be my biggest thing. Take 5 to 10 seconds between every answer, and then really think about what you're saying to um, help them psychologically. And then two, like your prescriptions is not just the first idea. It's something that hopefully won't hurt them even more from your because you already have that clinical base. Like you're either a PT student. That's probably going to be the first time you see someone with 9 out of 10 pain when you're doing your clinical, or you're already established, and then you just realize you have more than like 2 seconds to answer the question. That'd be the big thing. And also, don't try to make something up. Don't reinvent the wheel right there. I've tried that. Trust me, don't do that. There for a reason.
Yeah,
Have you
yeah,
ever
that's good.
noticed, the same type of injury? Patient one has a good mindset going into it. Maybe they dealt with the injury before, or maybe they had, a lot of support and a lot of peers around them supporting that injury. And maybe patient two, first time injured, very stressed, but you prescribe the same program. Patient one, rehabs a lot faster compared to patient two. Have you ever experienced that?
Yeah. There's a lot of studies that kind of document the exact same thing too, where that not just like they put it even both perform, so even more so than uh one patient is more compliant with it and actually does it as opposed to doesn't do it. Like let's say they both do it, but one has a better attitude about it or like really believes it's gonna work. Like I'm not sure
Mm.
about like the deeper what's it called the neurological signals to go through it, but the bottom line, yeah, it makes a huge difference. So like just being if you are a patient or if you're rehabbing yourself, just if you're gonna subscribe to a program, just like telling yourself you believe in it and like this is gonna help makes a huge plus to what you're already doing tangibly as well.
Yeah, I see that in kind of even the personal training space.
Yeah.
I've learned this new trick where like someone comes to me with shoulder pain, and I'll give them like a shoulder distraction with the resistance band.
Mm.
If I tell them, if I just give them the exercise, have them do it, sometimes they're like, "Ah, I still feel a little bit." But now
Mm.
what I do is I'll be like, this works for like 90% of people. After I give them this, typically their shoulder feels a lot better, and then they'll do it, and then they'll come out and be like, "Oh yeah, my shoulder does feel a lot better."
Uh-huh.
And it's about shifting their mindset. Like maybe it's a little manipulative, but it works.
Yeah, in a good way. Yeah, like a coach trying to
Yeah.
like, hey, like maybe like you do swing the bat hard. Like you're like 5 years old.
Right. Yeah. Yeah.
No, that's something that like I see like personal trainers are probably better than PTs a lot. at doing that. And something I need to remind myself to do more too is that shift of mindset. It's like, hey, like framing it like the intervention in a positive a positive direction as well, as opposed to like, hey, let's try this, see if it happens. As opposed to like, this usually works. That actually makes a huge difference.
Yeah. Eric is also a MMA fighter.
Yeah. See the ears.
Have you been training? What's the training been like lately? And are you having a fight anytime this year?
Yeah, so I've been out of the game for as a PT school and whatnot for several years now. Life gets in the way. But I've been training. I've been training back when I was in San Diego. I'm training up here in Portland as well. Hopefully we have a fight coming up by the end of the year. I just need to get a little skinnier, is what I've been telling people. But we're training, we're sparring, and then you guys will be the first to know for sure when I get back in the cage. As my first one as a licensed physical therapist for sure.
We got to get like some cool slogan for you.
Yeah. Back bend only, baby.
Spine day.
Yeah. But looking forward to getting back to San Diego. And then hopefully we'll get a whole studio for this operation. I think you guys are providing a lot of valuable info for not just, the San Diego community, but like when you guys are reaching out on Spotify and everything too. So this is exciting.
Thank you. Where can people find you? Instagram?
Yeah, you can find me on Instagram. Whether or not I allow you to follow me will be, up to my. I'm just kidding. No, that's all good. I'm not a celebrity. No, it's at Merrick Nation, at MERIC Nation. It's just when I was in middle school, they're like, hey, let's go around and give an M in front of everyone's name, but none of them like made sense phonetically until like mine was a vowel, Merrick. So that's what I stuck with. But yeah, so there's some. And on a side note, I'm hopefully starting a travel PT page soon as well. But you guys will be the first to know, to document the travels, the day to day, and like maybe some clinical cases as well.
Yeah, we definitely got to bring you back for a part 2 because there's so many unanswered questions that I think both Jared and I, we can go hours and hours. We can talk about exercise programming. We can talk more on the psychology of physical therapy. There's so many topics that I still want to continue on. So when you're free, we'll definitely reach out to you again and maybe get a part 2, part 3, maybe.
Yeah, let's see what the fans say. Maybe I'll change my fit for them. I appreciate
thank you so much, Eric.
Yeah, our first guest. Let's go. Thank you so much, Eric.
Thank you for having me, guys. Really excited for all this.